end. So once again, I'm Dr. Molly. We've got Dr. Rosalie and Dr. Mary here with us today. We're naturopathic physicians here at Prosper Natural Health. And we love working with the holistic approach. And when it comes to things like libido and wellness and hormones, it's something that often gets glossed over in conventional care because there's so many things that need to be focused on. But it's a really important part of our wellness. So one of the things that we want to make sure that we go over with you guys today is how to really recognize any kind of imbalances as they're starting. And we want you guys to understand why it's so important that hormones need to be balanced. We also want to help you understand how these hormones can be evaluated and what we can do to measure your unique hormone levels. And then we really are very excited to go over what we call our health hacks and our tips at the end so that you guys can start instituting things in your day-to-day practice that can be helpful for you in regards to health. So let's start by talking about this hormonal shift that happens usually around our 50s for folks. That's labeled menopause. And then for men, we have andropause. And what we see with women as they start going through this change is we start seeing their cycling, their menses becoming more and more irregular. We can see changes in their bleeding patterns. For some women, it ends up being heavier bleeds, and for other women, lighter bleeds. And often when we're thinking about a full diagnosis of menopause, it really means that we're not cycling for a full year. And as we're going through that transition, a lot is happening with our hormones, a lot of shifts are going on. And so we can see other symptoms come up. And andropause, although it doesn't get as much attention from the medical community, is equally as important. And this is happening for males as they are aging. And this often will end up leading in less of our androgen hormones, which we're going to talk about today, which include testosterone and DHEA. So we can have all kinds of symptoms that come up as our hormones are starting to shift. One of the ones that we're talking about a lot with patients are hot flashes, but we can also see more insidious things like weight gain happen, low energy. Often this discussion of low libido or sexual interest comes into play. For some people, they may even experience physical pain, like increased muscle and tendon pain. We also know that as these hormones shift, we have a higher risk of bone loss. We can also see changes with cognitive function, including brain fog. And then we also can see things like headaches increasing. And a lot of times this is hormonally mediated with migraines, for example. We can also see mood changes, including increased depression, anxiety, or even irritability. We also know that autoimmune conditions often can increase in this time, and those hormones are affecting our immune balance. And then as far as physical changes externally, we're seeing hair and skin changes as well, with those hormonal receptors being downregulated. So our goals with patients are ultimately to find balance. So we're always trying to strike balance in the natural medicine world. So we want to make sure we're not having too much, and we want to make sure we're not having too little. We also want to be thinking, especially when we're thinking about hormones, ways that we can get protective benefits to patients. So that involves our heart and vessel health, our brain, our central nervous system health, of course, bone support with reduction of osteoporosis, helping reduce musculoskeletal pain and atrophy of those muscles, and balancing that immune system. And those are all really beautiful benefits that we get when we have a balanced hormonal system, even into those menopausal and andropause years. So ultimately, we're wanting to also be thinking about managing symptoms for patients so that improves their quality of life. So if somebody is coming in telling us that they're having horrible sleep and it's after or during this hormonal transition, that's a big one that really can affect their day-to-day life. So we want to get that addressed by finding that balance.
in terms of menopause, andropause, and low libido, of course, we're talking a lot about hormone balance. But it's helpful also to just take a step back and think about the anatomy and physiology of libido ultimately for both men and women alike. So ultimately, when we think of libido, that's just, our innate sex drive. It's a nervous system dance. So that first bullet point says parasympathetic nervous system first. That's the fancy term for the rest and digest nervous system, also known as the feed and breed nervous system. So we have to feel relaxed in order to get in the mood ultimately. Secondly is the dance with the sympathetic nervous system. And the sympathetic nervous system is the one that pumps out adrenaline. It's our fight or flight nervous system. If you can imagine, we're running away from the tiger, and the last thing you can do is spread your seed. That's sort of where the sympathetic nervous system comes into play in this libido dance. And oxytocin is a hormone that's really important in this very specific sort of human and animal behavior. It's the hormone that peaks at orgasm, the one that stimulates pleasure. It's also the one that contributes to closeness and bonding and social interactions. When you're with family and friends, we're sort of pumping out oxytocin altogether. It's also the one that, curiously enough, is present during labor and is one of the things that we can give to laboring women to sort of help with bringing the baby out. So it's got this very procreative role, this hormone, and it's only kind of present in those times. It's also released during breastfeeding. So ultimately, when we think of low libido, there's a lot of things that can contribute. Dr. Molly talked about hormones, but there's also a whole mental emotional piece here where if there's depression, if there's anxiety, if there's relationship tension, it's very difficult to get into that parasympathetic state, that feed and breed nervous system, where we feel comfortable enough for intimacy. And then secondly is the physical components where, we need good circulation in order to have, both female and male erections. And ultimately we need good vaginal vaginal lubrication. So the opposite of that is vaginal dryness, often seen in menopause. Contributes to pain with sex, low desire, and ultimately something we can really treat pretty easily in terms of an outpatient treatment and naturopathically. Fourthly, there is pelvic floor dysfunction. If there's too much tension in the pelvic floor, it's really hard, again, to sort of relax into the moment. And vice versa, not enough tension, and we're sort of having difficulty mechanically. And then lastly, a big piece is our vaginal microbiome, and imbalances in that microbiome can lead to pain with sex and low desire. And then that hormones piece that Dr. Molly addressed earlier.
All right, so next we'll really dive into the hormones piece and how hormones are playing into our libidos. So testosterone is one of the major influences on libido. We think of differences in libido between males and females and, not to generalize that, but interestingly, males and females both have testosterone in different amounts, and we do see that play out across in individuals, that testosterone, when it's in higher amounts, can really make it increase people's sexual drive. So testosterone naturally decreases with age. This is a phenomenon known as andropause. That's kind of a slower transition in a decline in hormone than menopause. And this is present in both males and females. We see testosterone declining with chronic stress, and we can often find environmental contaminants will interfere with the binding of testosterone at receptor sites in the body, so that affects the testosterone's ability to act in the body. And we also see with oral contraceptive use, when we are flooding our bodies with this high level of estrogen and progesterone, this can feed back to the pituitary and where all of our hormones originate and shut down the production of hormones. And sometimes we need to really help testosterone come back on board after discontinuing oral contraceptives. Estrogens can play a role in libido, and this is largely because of their effect on the vaginal mucosa. So when estrogen, so within the vagina, the secretion of estrogen in those tissues keeps our tissues plump, and it also causes the secretion of mucus and that vaginal moisture, which can play a huge role when it comes to comfort during sex. And one that most people don't often think about is our thyroid. So low levels of thyroid hormone, even within the normal range, can decrease our libido. And this is in addition to many other symptoms of hypothyroidism, including weight gain and fatigue and depression. So this is one thing that we often check for when someone comes in for low libido. All right, so this is this complex web of the hormone cascade pathway that we're going to discuss during this lecture. And we for now, just take a look at it and note how complex it is and how amazing it is that all of this is going on on a cellular level on a daily basis. And particularly right now, I'd like to point out cholesterol as the origin of this hormone cascade. So we often demonize cholesterol because it can cause problems when it's really high in our bodies. But we do need some level of cholesterol to make these processes happen and to build our sex steroid hormones. And secondly, I'd like to point out at the bottom here a couple of these pieces of the hormone cascade. There's DHEA, which is one that you may not have heard of. This is a precursor hormone to testosterone and estrogens and can play a big role when it comes to the production of these sex steroid hormones before and after menopause. And then we have this group of hormones on the right here. And this is the 3 different types of estrogens that we will talk about. Note how they form from testosterone, which is very interesting, and they can interact with each other, and there's reactions where they can sort of convert from one form to another. All right, let's go to the next slide. Okay, so I'm going to explain these different types of estrogens now. So you can look to the right. They're basically the same molecule with just some slight differences in structure. And they are all secreted from different parts of the body and can interact with our body in different ways. So estradiol is produced in the ovaries and it declines after menopause. Before menopause, it's our dominant form of estrogen. Estriol is produced in the placenta during pregnancy. So it's the predominant form of estrogen during pregnancy. And this form of estrogen is known to be protective to breast and endometrial tissue. So you often see it in hormone replacement formulas for that reason. And then we also have estrone, which is produced in fat cells. So it's converted from testosterone to this form of estrogen outside of the ovaries and all over our body and our fat cells. And this is the main form of estrogen that's present after menopause. Estradiol and estrone can both be problematic in high amounts when they're not balanced with progesterone. Now, progesterone is a hormone that is also a major player premenopausally, and it also is protective to our breast and endometrial tissue. So as you may know, estrogen will help build the lining of the endometrium, which gives rise to menstruation. And when we are using estrogen postmenopausally, it's really important to have progesterone on board for anyone who has a uterus to protect that uterus from from too much proliferation, from too much building from estrogen. Then we have testosterone. So testosterone, interestingly, is also produced in the ovaries, even though we think of it as a male hormone. And again, that's one that does give rise to estrogen. And postmenopausally, there's a tiny amount that's produced in the ovaries, but it's another hormone that declines after menopause. And then we have DHEA. This is that precursor hormone that I mentioned before that can also play a role in the production of these sex steroid hormones.
So that's the science, which I know gets complex, but we want you guys just to have that basic kind of vocabulary here. And the real question for a lot of patients is, well, what do I do about it? And how do I figure out what these hormone levels are doing? So it's really important for your physicians and care team to really be thinking about the symptoms that you might be presenting and your personal risks. Like, do you have higher risk of cardiovascular disease in your family or bone density problems as you age? So what we like to look at are different ways of assessing these hormones. So in our clinic, we typically are using salivary testing, but there's also blood testing and urine testing for hormones. Now, these different test models will provide different information for your clinicians. And so we choose in our clinic to use salivary hormone testing because you can see that no matter, it looks as far as the type of hormones that are given afterwards as treatments, if they're put on oral or topical or vaginal, it will show accurate levels of those hormones. And the problem that we end up having when our patients are only getting blood work for their hormones is if they're on a topical, like a patch or a vaginal estrogen, or if they're doing a cream form of an estrogen or even testosterone or progesterone, that's not going to be accurate as far as the testing goes for the serum. It's going to underestimate a lot of times those values for that lab. So that's one of the reasons why we're predominantly recommending salivary testing for our hormone panels for our patients. There's also the option of using dried blood samples, which are taken from capillary beds rather than the venous veins, which they're doing for the serum blood collection. And those dried blood samples are really handy whenever we know that the person might be taking sublingual, so under the tongue formulations of these hormones. And for our patient population, that's pretty rare, but there are some instances when getting that capillary blood prick test can be very helpful for us. So when we get our hormone panel results back, this is kind of an example of some of the graphics that are on one of the tests that we use, showing the person's actual hormone level. So this is their estradiol, that most active form of estrogen. It's looking at their age and where they're falling in comparison to their cohorts of similar age. So their population of the similar age. So this person you can see has lower than optimal amounts of estrogen that they're making. We want them to be closer to that mid-green line. So that's just a nice little graphical representation for us. But we like to make sure that we're testing that estradiol, that very potent form of estrogen in the body. We always want to make sure we're looking at the progesterone because that balance between the two is absolutely critical. Want to make sure we're checking our testosterone. And then this other DHEA marker that is that other androgen side. So we think about that being a builder for that testosterone, if you remember back to that hormone cascade. And then often we'll also check cortisol as a portion of that because cortisol is going to come into play in regards to our wake and sleep cycles, and that can very much affect how our hormones are regulating.
Yeah, so that's exactly right, Dr. Molly. When we think about hormones, we definitely have to think about the sex hormones, but also the stress hormones, that cortisol that's made by the adrenal glands. So this is a visual that I find so helpful when I'm talking about hormones and low libido and menopause, andropause with patients. I bring this up with them because we're not just looking at the hormones, right? Not just looking at the ovaries or the testes and what they're pumping out these days, but we're also looking closely at the thyroid hormones and those adrenal glands, because if the adrenal glands or the thyroid are under functioning, it's really hard to get those hormones back in balance. So this next slide, we're going back to the biochemistry here. And this is a concept known as the cortisol steal. So again, if we go all the way back up to the top, we start with cholesterol, we make different hormones from there, including the progesterone, and it shunts over to cortisol if we're chronically stressed, leading to diminished levels of all of the other sex hormones, the testosterones, the estrogens, etc. So the cortisol steal is something that will sort of override, even if you're taking some hormone help, will sort of override that therapy ultimately, because the hormones are getting shunted over to that stress hormone, that cortisol, that is basically preventing healthy sex hormone function. To test the adrenal glands and to see where the cortisol is, we can do a bunch of different tests as physicians. Of course, we do a physical exam in office to see what's going on, what we can see with our hands and with our eyes. But secondly, salivary test is probably my favorite way to test cortisol because it's something the patient can do at home. So over, a series of 24 hours, we can get 4 tests of just a salivary, just have the patient produce saliva into 4 tubes at specific times, right when they wake up, right at noon, maybe midday or mid-afternoon, and right at night, to sort of see over time what that circadian rhythm looks like, how the cortisol moves throughout the day, right? We can otherwise do blood testing, which tells us a little bit more if there is a true sort of physiologic cause of low or high cortisol, things known as Cushing's disease or Addison's. We would see a lot of other physical symptoms if that were the case. But usually when we're triaging low libido and menopause, andropause things, we're sort of, our first line here is the salivary testing. I'll have Dr. Mary introduce our 7 health hacks next, big meat of the presentation here.
Great. Okay. So now that we've talked about all these important aspects of the way that our hormones affect our physiology and our libido, now we're going to dive into ways that you can support so that you can support yourself through the menopause transition and boost your libido as you age on a daily basis. So, within these 7 health hacks, we're going to discuss diet and lifestyle, ways you can support your libido and support yourself through menopause through herbal medicine and supplements, through hormone replacement therapy. We're going to get into the nitty gritty of vaginal care and the various ways that you can support your vaginal tissues. We'll talk about pelvic floor support, sleep and stress management, and sensual stimulation. All right, so our first health hack, number 1, is going to be diet and lifestyle. This is a big one. We're going to discuss ways to increase libido supporting foods in your life. So adding healthy fats, adding phytoestrogens and phytoprogesterones, and we'll discuss what those are in a moment. How to diminish inflammation through your diet, how to support your circulatory system, and within our lifestyle strategies, we're going to talk a lot about exercise and movement, as well as therapeutic sweating. So for a diet that supports libido and that supports your hormones as you age, it's really important to bring in fish oils. So we're thinking going back to that diagram of the hormone cascade, think about healthy forms of cholesterol that you can bring into your diet, as well as healthy forms of omega-3 fatty acids, which are our anti-inflammatory fat that we can, by increase in our diet, we can load our cells with these healthy fats that will then give rise to a less inflammatory response when we do go to have when our immune system is reacting to something. So within that, we will bring in fish oils that are really high in omega-3s, butter, a good form of cholesterol from raw, whole, or unpasteurized milk from pasture-raised cows, paying attention to having lesser amounts of added hormones and added antibiotics in our dairy products. Extra virgin olive oil is a great form of fatty acids that you can incorporate into on top of salads and into your life on a daily basis. Unrefined flax oil is a great form of omega-3s that you can do by the spoonful or again add to salad dressings. And then we've got coconut oil, egg yolks, raw nuts and seeds, great forms of omega-3s and omega-6s. And avocado oil is another amazing healthy fat to add.
We also want to be including seeds in our diet. And we know that there are certain seeds that fall into these categories called phytoestrogens, which are basically plant-based estrogen analogs. And there's also phytoprogesterones. So we've divided here for you guys up some of the major seeds that we find in the phytoestrogen category, and then the seeds that we find in the phytoprogesterone category. Now, for our cycling women in particular, we're often dividing these and giving them during certain times of the month to help promote estrogens at the beginning phase, and then that secondary phase of the cycle promoting the phytoprogesterones. But for folks that are past that menopausal and transition and or who are going through an andropause period of time, we're thinking more about continuously having these fats in our diet so that they are available for our body to help make those sex steroid hormones. And then also promoting with these specific phytoestrogens and phytoprogesterones when it's appropriate. So we love these pumpkin seeds and flax seeds for our phytoestrogens. And for the phytoprogesterones, we're thinking more along the lines of sesame seeds, sunflower seeds, and evening primrose, which many of you may have heard about. So sources of phytoprogesterones are actually found in a lot of very common foods, like even found in apples and carrots and some in your coffee. But we also have them in larger amounts in things like soy, fennel, sesame, alfalfa, red clover, and hops have higher amounts of these. And once again, these phytoestrogens can help provide the key, if you will, to the receptor sites for estrogens in the body and help fill those pathways so that if we are low in estrogens, it can be very helpful for balancing. So different types of phytoestrogens that have a lot of research behind them are these lignans and isoflavonoids, and specifically this one, genistein, which we know from the research not only acts as a phytoestrogen, but also helps promote with bone density and weight loss. These mimic, as plants, they're mimicking those estrogens in the body, and they can actually help with modulations of things like hot flashes. They can help with some of the vaginal dryness for some folks too. And we know that once again, they can be helpful for bone density because of their actions on those receptor sites. So pretty powerful components from our plants there. So Dr. Rosalie is going to talk about inflammation.
Thanks, Dr. Molly. Yes, there's a lot we can do with diet in terms of supporting hormones through all sorts of transitions of life. And again, you'll see us talk about this piece here, mitigating inflammation, over and over again in a lot of our doc talks, because it is something that is so detrimental to all of the body systems. If you're experiencing chronic long-term inflammation, it's just not conducive to making healthy hormones, to having good circulation, etc. So ultimately, adding in another plug here to add in those anti-inflammatory foods, opting for an alkalinizing diet, which means one that's high in vegetables and fruits. And ultimately eating the rainbow here, right? And the alkalinizing diet is one that's low in our meat and dairy products, low in sugars and alcohols, low in refined and processed foods. All of those things are quite acidifying and inflammation promoting in the body. We can use food as medicine here to mitigate inflammation. Turmeric, we've heard of, that active constituent of curcumin within the turmeric is a really potent herbal anti-inflammatory. So something you can grab the turmeric root at your local store and fresh grate it onto your salads, or just use it powdered in rice dishes, curries, etc. Again, a plug here for those healthy fats, and that has to do with the fact that they are anti-inflammatory, right? They have omega-3s in them, which are anti-inflammatory types of fats. And lastly, brassicas, right? Which is this term for our cabbage family plants. Because if we see on that next slide here, our cabbage family is full of antioxidants known as sulforaphanes, okay? And not to mention other constituents that are hormone protective, especially when we're thinking of breast cancer, etc. So it's just, if you're getting brassicas in just once a week, it's definitely worth boosting that dose. These are definitely superfoods. And we're thinking about broccoli, we're thinking about cabbage, bok choy, kale, and we can get it from fermented foods, stir fries, eaten raw, or supplements even. Next, a big piece when it comes to diet is to improve circulation, right? So if we think back to the physiology of libido, the physiology of erections in general, both the male erection, but also the female clitoral erection, it has to do with circulation. We need blood flow down there if we're going to feel sexy, right? So ultimately, we must improve circulation. And poor circulation is quite often implicated in low libido, difficulty maintaining erections, and even difficulty reaching orgasm. So think about our heating, stimulating herbs and foods, right? Ginger, cayenne, nutmeg is one from the Ayurvedic tradition that has a lot of studies in the primary literature about it being a potent aphrodisiac and something that improves sexual function both in rat models, but also the human models. So adding these into your diet can be really helpful for helping your circulation.
Okay, so next we'll talk about exercise and movement. As Dr. Rosalie was just mentioning, circulation is incredibly important for libido, and that vasodilation of our genital tissues is very important. And exercise is one of the main ways we can improve our circulation. Each time you work out, you have to send blood flow all around your body, and it makes your heart pump more, it makes your it just brings blood flow to a greater area of your body than when you're just sitting. So it's a really, having aerobic exercise in your life is a great way to increase your libido and to support your heart health. Exercise is also great for stress reduction, allows you to sleep more easily, and really amazing for mood enhancement. So after a significant aerobic exercise where you're really getting into those deeper energy reserves, you notice a release of endorphins, and that is great for your mental health. And again, really important when it comes to getting into that parasympathetic nervous system, the rest and digest state that allows you to feel sexy. Exercise also helps move your lymph, reduce toxin storage in your body, and it increases the conversion of 16 hydroxyestrogens to 2-hydroxyestrogen forms. This is a complicated system to go into, but essentially it improves the conversion of estrogens in your system in a way that's safer for your body to have those circulating estrogens. And then lastly, it improves, exercise is going to increase your testosterone release in your body. And we discussed before why that's important for libido. I apologize, there's a puppy here. You might hear her lapping water in the background. So next, we'll talk about therapeutic sweating. So therapeutic sweating, whether it's just getting out and getting a really good aerobic exercise and really working up a sweat, or being in the sauna, is going to engage the body's natural elimination route through the skin. So great form of detox. And it also increases our metabolic rate. So good for breaking down our fat tissue, which often kind of gives us a more favorable hormone profile for libido, and also helps us release fat soluble toxins. And again, going back to the benefits of exercise and movement, it's going to help increase endorphins, help us relax, and improve our sleep.
So I get the privilege of talking about some of the herbal medicines with you guys today. And there are just so many amazing studies that have come out over the last 10 years incorporating herbal medicine specifically for libido and also for hormone balancing. So we've kind of broken down the herbs today into our hormone balancing herbs, which include our phytoestrogens and our phytoprogesterones, our adaptogens, our nervines, and then those circulatory stimulants, because that is such a very important piece as well. So I wanted to quickly just put in a little plug for this amazing book called Aphrodisiac that was written by one of our local authors here in Port Townsend, Kimberly Gallagher. This is one of the most beautiful herbal books I've ever had the privilege of owning. It has some amazing pictures and recipes and discussions of ways to really stimulate the healthy vitality through a connection with herbs to reach that sexual fulfillment, which is pretty amazing. So if you haven't had a chance to check this out, it's a really phenomenal book and just a really beautiful, even like gift coming up with Valentine's Day. But I just even like it for individuals because I think it's so important not to ignore our own individual libidos and self-care in that regard. So when we're thinking about these herbs, we're going to start talking about the hormonal modulating and boosting herbs. So we talked a little bit already about phytoestrogen foods, but we also see these powerful actors like maca, licorice, red clover, and white peonies, which is all in that phytoestrogen category. So remember, these are plants which are having these chemicals in them that mimic estrogens and bind to our estrogen receptor sites. We also have certain herbs such as nettle, which involves the sex hormone binding globulin. And that's a really important one as well for making more of these hormones available in the free form in the body whenever we're reducing that sex hormone binding globulin. So nettle can be a really nice one as well for helping with the hormonal balance. I love this picture here of, of the chocolate and the lemon and the licorice here as well. Just lovely. So one of our very favorite herbal support remedies that is a phytoestrogen, if we deem that to be the route we want to go with our patients, is this gelatinized and standardized maca root. And so what that means is rather than just taking maca in a powdered form, say in a smoothie every morning, we're making sure that we're getting a very specific clinical amount and we're timing it at certain times of the day. And what's really cool about maca is it's considered a non-hormonal adaptogen that actually stimulates this brain feedback loop with the hormones. So this hypothalamic pituitary axis. And there have been really cool clinical trials done that are very clinically significant for our postmenopausal women using this standardized maca root and having a significant reduction in their symptoms, having better libido. And we also see adrenal balance, so reduction in stress hormone production, and also better sex hormone balance overall when we look at the clinical picture after taking that. So that can be a pretty powerful tool for some patients who might not want to take a direct hormone.
Thanks, Dr. Molly. So with these phytoestrogens and phytoprogesterones, they are modulating, right? So, it really depends on the individual patient, what we're recommending, but they're not something that are going to boost us quite in the same way as like a bioidentical hormone replacement. I just want to put in that plug there because it is important to distinguish. But next in our herbal toolbox here are these amazing herbs known as adaptogens. And the ones that have been very well studied for both male and female low libido our ashwagandha, our shatavari, our gokshura. These are actually all Ayurvedic herbs. So ashwagandha in Sanskrit translates to smell of a horse, right? So you can imagine, a very strong horse. We're sort of channeling that energy along with the robust sort of studies on the constituents of ashwagandha, helping with both male and female low libido. There's just, a quick search on Google Scholar leads to many studies, randomized controlled trials, systematic reviews, etc., on how helpful ashwagandha is as an adaptogen for this specifically. Shatavari is sort of the feminine counterpart in Ayurveda of ashwagandha, with an affinity for the pelvic organs. In Sanskrit, amazingly, it's what's known as 100 husbands, right? So it sort of speaks to its power ultimately. And then thirdly is this herb known as gokshura, which is one of the ones I use fairly commonly in my Ayurvedic practice, because it has such a great affinity for the bladder and genitourinary systems in terms of clearing any stagnancy there and supporting those tissues. A lot of Ayurvedic related studies based on it enhancing stamina and energy sexually, but also helping with mood, treating seasonal affective disorder, which, if we think back to our earlier slides, mood disorders definitely play a big part into low libido. So this supplement is one that we've got in stock here at the clinic. It contains that ashwagandha, that gokshura. It's got some circulatory stimulants and aphrodisiac herbs. I use it, it says male support on there because it's something that sort of boosts testosterone and libido, but ultimately it's I use it also for some of my female patients in terms of helping specifically with that piece, especially if we've looked at their hormones and we know that it's sort of safe to push that pathway.
Okay, so now we're going to get into another class of herbal medicines known as Nervines. So these are herbs that are typically acting on our nervous system and generally helping us get into a parasympathetic rest and digest state. Damiana is one of my favorite herbs. It's so good as something to help one relax. That's that nervine component, and it can really help you get into the present moment, whether that's in your own body, with yourself or with a partner. Kind of get out of your head and into your body is the way I think about it. And there's some great studies that have been done on this herb. It was shown in a clinical trial to improve sexual function in women with low sexual desire. And it was in a rat study, there was some evidence that it involves the nitric oxide pathway. Many of you might be familiar with with Viagra as a common erectile stimulant. So if you think about that erectile tissue in both males and females that involves that nitric oxide pathway, and vasodilation is an important mechanism. So Damiana is acting on both the sort of mental emotional piece and the physical piece. We also see yohimbe is another major stimulant. This is an herb that originally came from the African continent, and it's one that is kind of really strongly increases libido in males and females. It's known as an alpha adrenergic blocker. So it's blocking that sympathetic response in the body. And it is really great specifically for erectile dysfunction and when either males or females are having a difficult time reaching orgasm. Oh, and with that one, just be sure to use it with caution. It is contraindicated in people with high blood pressure. So definitely talk to an herbalist or naturopathic physician before considering using it. All right, next is our circulatory stimulants. Again, that nitric oxide pathway and circulation is very important for our erectile tissues. So ginger is a great one to enhance vasodilation. You can use that as a food in cooking. You can drink it in a form of tea and then or in supplement form. And then we have ginkgo, also enhances microcirculation and is particularly helpful with erectile dysfunction. And then we have nutmeg, that's a heating herb that you can add to food or take in powder form in higher doses. And this has been shown to be helpful in premature ejaculation.
So our herbs can be very powerful, as you guys have seen here, for helping with our hormonal regulation and for stimulating libido. But we also have this tool of hormone replacement therapy, and that can be very, very helpful, especially if we have significantly low lab values for our patients. Now, there are so many different ways to approach this. And here at Prosper, we have chosen to use bioidentical hormones whenever possible because they have much less risk that comes with them in regards to side effects and risks as far as like cancer concern and things like that whenever they're dosed appropriately. So we think about our estrogens and them usually being paired with progesterone, especially if a woman still has a uterus. We want to be thinking about those in regards to that E1, E2, and E3 formulation that we talked about before for the different forms of estrogen and figuring out what is appropriate for that specific patient. Now, these can be given as topical patches or compounded into creams, which is oftentimes what we're doing in our practice. We typically are not giving them orally because they have to go through the liver, and that can be problematic as far as increasing our risks. We also have the option of doing topical phytoestrogens, although generally when we're thinking about hormone replacement, we're thinking about having that either compounded or getting it through a pharmacy. There are some really beautiful phytoestrogens and phytoprogesterones that have been standardized to a milligram amount that allow us as physicians to dose those, which can be pretty powerful as well. So we do think about progesterone coming in often in that oral micronized form. So it's a little bit different than only doing it topically like we do the estrogens. That's one that helps so much with the sleep that we're often giving it in the evening. And we can also give it in a topical form as well. So with our testosterone, that can come in once again in a few different forms, either topical or injectable. And there are compounded forms of testosterone as well. And especially for women, when we're trying to do very small or physiologic doses, we're often having that compounded. DHEA is another hormone that we often are supplementing with if these levels are very low for people. And that one is an oral supplement. It can also be given topically, even vaginally as well. So there's many different ways to give this hormone replacement therapy. The most important takeaway for you guys today is please understand that this is individualized, and we always want to be working with patients to make sure that we know what's going to be appropriate for them in regards to their risk and benefits, as well as what their goals are. And the next slide, which I'm really excited about, is about vaginal care, but I'm going to hand this off to Dr. Rosalie. Before I do, I just want to put one thing forward, which we often forget to say, and that is that the vaginal area is kind of like a self-cleaning oven. We really don't want to be adding a whole bunch of soaps and things like that to it. And Dr. Rosalie is going to talk about why that is with the microbiome, but I cannot tell you how many patients I sit with who are having recurrent UTIs or vaginal dryness or vaginal atrophy, which is that standard thinning of those tissues and drying of those tissues that happen at that period of time when our hormones are decreasing during menopause and after. And often it's so very aggravated by the addition of soaps when they're cleaning themselves in the shower. So soaps on your inner thighs and anal area is fine, but just water only when it comes to cleaning out that vaginal mucosal tissue, especially.
Indeed, that's so right, Dr. Molly. It's, when it comes to vaginal care, it's sort of the thing that gets placed, on the shelf for later, right? But it's so important to support the vaginal microbiome at any phase of life, and especially during menopause, right? Because supporting the vagina also helps support the surrounding tissues, the pelvic floor, the urethra, and the bladder, etc. So when I think about vaginal care, I'm thinking specifically about supporting the pH or the acidity of the vagina, because in that acidity lives a very specific type of bacteria, and that's the specific type of microbiome that is supportive to the tissues, preventive of infections. So sometimes if we're having recurrent yeast infections, bacterial infections, we think primarily about that vaginal acidity, and we want to bring it back into balance by sometimes adding some vaginal probiotics, especially lactobacillus types, increasing the acidity with some supplements, suppositories even, that will support that acidity. Also, what is helpful are using natural lubricants, right? If we're sort of using lotion on our skin, we've got to think of using lotion in the vaginal introitus and in those tissues that over time can atrophy, especially in menopause. And the natural lubricants are important because, again, they support the vaginal microbiome as compared to increasing or decreasing the acidity or adding in, components that are inflammatory to the tissues. Some of my favorite lubricants to recommend to patients are, Allogel, coconut oil. There's some naturally based sort of creams and lubricants that you can find as well. We also think about avoiding antibiotics, right? Because antibiotics, there's a time and place for them, but if they're not needed, then let's not have them on board. Otherwise, they can wreak havoc in all of our various microbiomes, especially in the vaginal one. I've seen this time and time again where patients, especially female patients, take oral antibiotics, end up with a yeast infection, right? Because it sort of has killed off the vaginal bacterial microbiome, allowing for candida, that yeast, to come into play. If there is yeast, we've got an excellent supplement that helps support that. And then lastly, those vaginal estrogens topically applied, especially in the perimenopause, postmenopause state, helps with plumping the tissues and making sure that they're nice and juicy and prevent from vaginal atrophy. So here's some of the forms that we end up using. On the left here is our prescription forms of the topical estradiol. In the middle and on the right are some of our phyto estrogens, some with DHEA, that precursor hormone, in them as well. They're just hydrating ovules is what they're called, and they can be applied intravaginally. And as we mentioned, the estrogens come in different forms, that DHEA is also very supportive to the vaginal tissue.
Okay, so next I'll introduce the concept of the pelvic floor and what can go wrong in the pelvic floor and how we can treat it. So if you can look at the right hand side of the slide here, this is a diagram of the pelvic floor muscles. And it's a whole hammock of muscles that is below our pelvic organs, so below our bladder and uterus and the prostate in males, and between our hip bones. And as you can see, all of the openings of our vaginal canal and our urethra and our rectum go through that pelvic bowl. So when there's dysfunction in this pelvic bowl, usually from either weakness, from inactivity, or overly tonified muscles, so muscles that you just can't relax, there can be a lot of areas of dysfunction that can result. So you can experience vaginal pain and spasm. There's a condition called vaginismus where the opening of the vagina and the pelvic floor muscles just get very tight and cannot relax. And this can cause a lot of pain with sex, and particularly penetration. We often will see urinary incontinence. This can be either from weak or hypertonic muscles. So that's when you're leaking when you cough or when you laugh. And sometimes you have that extra urge to urinate followed by some leakage. We can also, again, have pain with sex that can be kind of at the opening of the vagina or in the deeper pelvic floor muscles. And then a lot of people have hip and gluteal pain, hip in their, in their gluteal area, pain in their gluteal area and in their hip, that you just can't quite locate the origin of. And when you go to treat these pelvic floor muscles, you'll kind of recreate that pain pattern, and you can find a way to treat it, which is always very exciting. And then lastly, constipation is a big one. I've had patients with lifelong constipation that once they get pelvic floor work are able to work through that long-standing pattern. So treatments for pelvic floor therapy can include release of those pelvic floor muscles. So just like any other muscle, like your upper shoulders that get really tight and can get knots in them, you can work them out with manual therapy. So that can be external or internal manual therapy. And then we have a bunch of different exercises. You've probably heard of Kegel exercises. But exercises to both tone and relax the pelvic floor muscles. And this is often a referral to physical therapy. And there's so many good physical therapists in town that do pelvic floor work. And I am also offering this at Prosper now as well. So if you're dealing with any of these issues, please reach out, because we can really get to the root of a lot of these pelvic floor dysfunction problems and do it from a holistic naturopathic perspective. All right, and next, our next health hack is sleep and stress management. This is a big one, as you can imagine. So sleep plays a large role in libido, as well as stress. If you're not getting enough sleep and your stress hormones are really high and you're not able to get in that rest and digest state, it's really hard to feel any sensual energy for yourself or for a sexual partner. So within supporting sleep, we're often working with progesterone. That's a hormone that can help us feel more relaxed and help promote deeper sleep. Often working with melatonin to get our circadian rhythm back on board, and herbal medicines that help us relax in the evening. We can do sleep hygiene practices, so really cutting off any stimulating forms of any screens or looking at your phone for at least an hour before bedtime, and really dialing in a bedtime ritual is important. We want to support our circadian rhythms so that we have that natural rise in cortisol early in the morning, and then decline in cortisol later in the evening, that allows us to feel tired and go to sleep. We can do that with adaptogens and adrenal support. We also want to just be careful with stimulants, avoid coffee after noon, and just overall decrease the amount of caffeine you're consuming. And then also we want to curb depressants. Alcohol can often help people fall asleep, but then 3 hours later they'll wake up from this kind of rebound reaction. So another major thing to think about if you're dealing with sleep issues. And then we really want to focus on stress, as you may have experienced, or you may have experienced with your partner. If you're stressed, it's really difficult to feel sexy. So acutely, we have these herbal remedies. Labella is lavender in a pill form that can be really helpful. We also have liposomal neurocalm, which can be used at the moment to kind of calm down. We can support chronic stress through adrenal support and adaptogens, as Dr. Rosalie was talking about before. Diaphragmatic breathing, really kind of lowering your diaphragm and breathing into your lower abdomen, can help stimulate the vagus nerve and promote that parasympathetic nervous system. And then another major thing to think about is if there's stress in a couple, or you have a history of sexual trauma, there's a lot to work through on a mental emotional level, and you can seek out couples counseling. And there are counselors that are specifically focused on sex therapy, on sexual aspects of our health, so of our mental health. And those are great people to reach out to if you're having any interpersonal dynamics that are affecting your sex life. All right, and lastly, as I mentioned before, we have these great adaptogenic herbs that can be supportive in reducing our cortisol response, and our response in the moment to stress, and allowing us to have a more even release of epinephrine, of cortisol throughout the day, so that we can be awake and be active when it's appropriate, and then we can relax also when it's appropriate, and we avoid that burnout phase of the stress response. So these include Asian ginseng, Siberian ginseng or Eleutherococcus, ashwagandha that Dr. Rosalie was talking about. It's a great Ayurvedic herb, and a number of others. And I really like this combination called Cortisol Manager that we use a lot at our clinic.
We also just want to invite you, if you happen to have any of these things ringing true for you today about potential blocks for your own hormonal balance or libidos, to go to our website and look at our archived video Zoom webinars that we have recorded there. We've got one specifically on stress. We have one specifically on sleep, and that might help you kind of untangle that as well for yourself. So our last health hack of the day is sensual stimulation. And this one is absolutely critical when we're discussing libido and arousal. So when we're talking about our sexual response, we're breaking it into 3 phases here as scientists, as physicians. So we're thinking about the arousal phase, which can last minutes to hours. We're thinking about a plateau phase, and then an orgasm phase. And this is important because these phases require different nervous system stimulation. So different areas of the nervous system and different hormonal cascades are coming into play with these different phases. And so if there's a breakdown or one or more of these phases, it's important to figure out what's involved and what's the physiology behind that. So we know that central stimulation and orgasm has profound effect on our health. We see it enhance sleep. We know from studies that it enhances immunity, specifically clitoral stimulation enhances immune reaction, which is pretty wild. So it's like, oh, the next time you get sick, don't forget about that as a tool. There's also an enhancement with circulation and tissue healing whenever we're having these sexual responses and arousal. And then we also get this oxytocin release, and that's such a very powerful hormone for us as humans because it does help us enhance our connectedness. It helps us with our mood and our socialization. So central stimulation can take on many different forms. It's not just about having penetrative intercourse. So we want to really make sure you guys understand that we like this idea of skin to skin contact, and this can be a self-engaged practice. It doesn't have to be with a partner. As far as thinking about this as we go through our life, we want to also make sure we're adapting our activities to be appropriate for us. So it may involve using specific pillows, props, bolsters, things like that to support us so that we're not in pain or discomfort in certain positions. We might want to engage with certain stimulation aids like different sex toys to help us. And we also want to remind, especially our female patients, that it's important not to be shy with lubricants. They can just be very, very helpful aids here, especially if we're dealing with any kind of issues with vaginal atrophy. And then we want to also remember to schedule in time for intimacy, even if that is just self-touch, making sure that we're making space in our schedule to allow for that and allow for that exploration and stimulation. So we also wanted to just remind you, if you are local here on the Olympic Peninsula or even here in Washington State, that we have an awesome holistic sexual wellness shop that has opened up here in Port Townsend called Vespertine. If you haven't had the privilege of going in there, we really recommend that you treat yourself. They are just have such amazing, tasteful, quality products and have really good resources for people. So when we're thinking about different lubricants and different sensual aids, they have a lot of those, which is wonderful. And we're just so happy that they're here for us in Port Townsend. So next, I want to hand this off to Dr. Rosalie. She's going to talk about the Ayurvedic approach, and then Dr. Mary is going to share the Chinese medicine approach, since they have those specialty degrees as well as being naturopathic physicians.
Thanks, Dr. Molly. Yes, this is where we wrap up our doc talk and sort of pull away from the Western medicine and dive into the Eastern medical practices here. So Ayurvedic medicine is a traditional medicine from India. And in Sanskrit, it means the science of life, essentially how to live a balanced life, right? And so when we think about low libido, this is a huge topic in Ayurveda. It's something that with my Ayurveda consults, we always dive into this topic, just like we always dive into the topic of diet and bowel movements, right? And sleep. So it's just a big piece of the puzzle. If a body is not able or desiring of sexual intimacy, it involves an imbalance ultimately. And so to treat that low libido, we've got to think of increasing kapha, which is our earth and water element here, decreasing vata, the air and space element, and boosting with herbs and foods known as Vajikarnas, which are aphrodisiacs. These are the types of Ayurvedic herbs and foods that nourish the reproductive organs, increase fertility, promote libido, and are essentially anti-aging at the end of the day. So to increase kapha, remember it's our earth and water element. We're boosting juicy, sweet foods. It sort of makes sense. We're pulling from the earth here. Things like coconut and dates are very kapha promoting. Oily foods like avocado and ghee, again, are sort of helping with lubrication from the inside out, helping build that kapha element. And then secondly, to decrease vata, which is air and space, right? If we're feeling spacey and ungrounded, we're sort of in that sympathetic nervous system, the fight or flight nervous system. The best way to decrease vata is to ground with routines, be it sleep routines, eating routines, or just scheduling in time for self-care every day. Vata is also very cold, right? If we think like about being in space, it's very cold out there. So we've got to think about warm, easy to digest meals as ways to decrease vata dosha. Heating foods, again, are going to help with circulation. Again, here's where garlic and nutmeg come back in the Eastern medical tradition as well. And then a concept known as abhyanga, which is our oil massage of the whole body, right? It's lotioning the skin organ, our largest organ of the body, so that our inner skin can also be lotioned and lubricated as well. Those Vajikarna herbs and foods, one of my favorite go-to treatments for low libido is garlic milk, surprisingly enough. Think of garlic as being pretty kapha promoting, but also heating and circulation stimulating. It's quite delicious. You just chop a couple of cloves of garlic and add it to warm coconut milk, and you'll be surprised perhaps by the effects. And then saffron tea is another very well studied Ayurvedic aphrodisiac for helping not only with the mental emotional piece, but also the physical sexual piece of boosting libido specifically. A lot of great studies on saffron.
All right. Thank you, Dr. Rosalie. So next, we're going to move into the traditional Chinese medicine side of things. And so when it comes to menopause and libido, in Chinese medicine, this is often associated with the kidneys. The kidneys are the organ that guides our growth and development and reproduction. And over time, we see a decline in kidney function with age. And here we're talking about not just the Western kidneys, but the Chinese version of the kidneys. So it has a mental emotional piece. It has to do with the water element. And it does involve our actual bladder and kidney function from the Western medical perspective, but it's more than that in the Chinese medicine perspective. So as we see this kidney deficiency over time, this can show up in many different ways. And one of the things that I love about Chinese medicine is it really recognizes and addresses the differences that we all have between us and how we all have our different constitutional makeup that will affect the way we respond to phases of life like menopause. And then it gives us really direct ways to treat people in their vast differences with really specific, targeted, personalized therapies. So here, as you may have experienced, you versus your friends and other people in your larger community all go through menopause very differently and can experience low libido very differently. So we have these different patterns that are recognized in Chinese medicine. We have kidney yin deficiency. Kidney yin deficiency is often associated with urinary problems in addition to heat symptoms. And a lot of dryness. So yin is the moisturizing, nourishing, cooling substance within Chinese medicine. And as yin declines, we experience a lot of heat and dryness. So with kidney yin deficiency, this can be vaginal dryness and eye dryness. And then you can often have this yin deficiency, so that deficiency of the cooling, nurturing aspect, with heat rising. So when we don't have the yin to ground the heat, it can often kind of flare up and cause problems. So this can lead to really strong hot flashes and sweating. And you probably know some people that struggle with those more than others. We can also see a decline in or a kidney yang deficiency picture. Yang is our kind of external heating active, the active element within Chinese medicine. And when that yang declines, people often feel really cold, they feel really fatigued, and they're lacking energy. So you can imagine your libido can really decline when you're in that state. And then we can have kidney yin and yang deficiency, which is a fun combination of both of those. So this is a slide laying out the most commonly used herbal medicines. Oh, sorry, can we go to the next slide? Thank you. So with each of these different syndromes, there's a different Chinese herbal medicine formula that can target that specific pattern. And then within that, you have a set of, say, 6 to 10 herbs within each formula. And then you can also add other herbs to individualize the formula. So one of the most common forms of herbal medicine for menopause that is used extensively and is very well researched is Liu Wei Di Huang Wan. That's a combination of about 10 herbs, or 6 herbs, that is. And so that's for kidney yin deficiency. If you have kidney yin deficiency with heat rising, you can add these extra cooling herbs, and that forms the formula Zhi Bai Di Huang Wan. And then, as you can see, there's other herbal formulas that we can use for kidney yang deficiency, and then a combination of both. So at Prosper, I use a lot of Chinese herbal medicine. And then one of my main forms of treatment that I love to use is acupuncture. And acupuncture has been shown in clinical trials to really help with those menopausal hot flashes. In one study, they found a 40% reduction that was maintained over a period of 6 months after treatment. So really good thing to consider if you're really struggling with hot flashes and various aspects of menopause and decline in libido as you age. So I just want to put in a plug here for our bonus Doc Talk next month on acupuncture and Chinese medicine. It's going to be on March 1st, so the first Tuesday in March at noon. And we're going to really dig into the different aspects of Chinese medicine. It may sound like I'm speaking a different language when I'm talking about these things in our regular doc talk. So this is really your chance to kind of get a sense of what I mean when I say yin and yang and qi and blood from a Chinese medicine perspective. We'll go into the 5 elements and how they're related to our organ function, and then go into the acupuncture meridians and also do a small introduction to Chinese herbal medicine. So I look forward to seeing you all there.
So this wraps up our doc talk, but I do want to also invite you guys not just to that awesome talk that Dr. Mary is going to give on March 1st, but also on March 8th, we're going to be talking about the respiratory tree. And that is a piece of holistic health model that's often overlooked. So we want to really take time to discuss how important that is. So not just breathing and lungs, but how our nasal passages affect our nervous system, how it can impact our sleep, and how it can impact our energy and mood even. So we're really excited about that, and we hope that you guys can join us. Let's see, do we have any specific questions from today? There was a question about chia seeds being equivalent to flax seeds, and flax has more phytoestrogens. So it looks like Dr. Rosalie answered that, but both are great forms of omega-3s. So we do like that for balancing the inflammatory component with the omega-3s. So if you guys have questions about hormones, questions about libido, questions about pelvic floor dysfunction or circulation, erectile dysfunction, those kind of things, please reach out to us. We have a lot of different tools that we can draw from, and really we just love to individualize our treatment for our patients to make sure that they're getting what they need. So we look forward to working with you.